You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you are considering dental implants. If you are missing a few teeth or if you have a loose-fitting denture, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. George Duello. Dr. Duello is the founder of Periodontics Limited in St. Louis, Missouri. We've invited him on the program today to discuss who's a candidate for dental implants. Dr. Duello, welcome to the program.
Randy, it's nice to be here. Thank you.
All right, now before we get into today's topic, tell us a little bit about your practice.
Well, I have been in St. Louis since 1983. I've been a dentist since 1979. I'm in private practice in practice of periodontics. And
what is a periodontist?
A periodontist? A periodontist is a dentist who has gone back to graduate school, usually specialized in bone and wound healing and primarily helping people save their teeth. And that's what I started out with, but I also had an interest in dental implants early in my career as a periodontist.
Is that pretty much all you do at your practice, dental implants?
Right now, I would say that's about 85% of my practice is dental implants and helping people restore their smiles and or replace teeth with dental implants.
Now, you're a known expert worldwide. You're a teacher, lecturer. Is that right? Tell me about that, with Nobel Biocare in particular.
Yes, I have had a wonderful opportunity to share my knowledge with my fellow colleagues and travel throughout the United States and Canada to teach about dental implants and how their practices would be beneficial to offer those services to their patients, and I teach some of the technical aspects of actually doing dental implants.
How long have dental implants been around?
Dental implants have been around for about 50 years.
Okay.
In various forms. But today we are in the current state where we now have the ability to do conservative treatments, make them look better than ever. We have newer materials that are more cosmetic and more forgiving to the patient as well as their bone and their gum tissues. So the evolution of dental implants has taken 50 years, but now the state of the art really allows us to give people the optimum result for their health, their comfort, their appearance, and do it in a very safe and conservative manner.
Now, you use a CT scan. In fact, it says you were the first ICAT CT person to have. Tell us about that.
Well, today in dental offices, we actually can have machines instead of having to send you to a hospital. We have smaller machines that take less radiation, can give us instant information as to whether you're a candidate for dental implants. It also helps us in the treatment to do the surgery where we now know in advance what the bone looks like, so we don't have to do surgical voyeurism with our patients and tell a patient.
What does that mean, surgical voyeurism?
Well, many times a doctor will say, well, we have to do the surgery and open you up and find out what's there. It's kind of like cutting into the pie to find out how well it tastes.
Is that right?
Yeah, but now...
Is that being done, though, today?
Oh, it's still done, and it's still necessary in certain cases, but with the advent of CT technology and computer software, we now actually can do a surgery on the patient before we ever do it in the mouth. And it's kind of like a video game for a surgeon.
Wow.
So it's a wonderful tool, and it gives the surgeon confidence. It also gives the patient confidence because they know we know what we know before we go in. Another new thing in dental implants is now we have the ability to put a tooth on the implant that day, or in some cases actually hook a whole set of teeth, a denture, onto the implants the same day.
How soon can they eat after something like that?
Well, we tell them they have to be comfortable and they have to use common sense, but soft diets, pastas, scrambled eggs, things that are not hard to chew. We don't want them chewing a steak, obviously, or peanut brittle, something like that, because it has to heal. Just like you put a cast on your arm, that has to heal over a period of time. And we know in about 2 months, they can probably start chewing normal food again. But the good news is they're never going to be without teeth. So their appearance doesn't change.
And in one day, is that right? They go in?
In one day. That's a very common...
How new is that? How new is that?
It's a relatively new phenomena, probably within the last 2 to 3 years. The science and the technology has caught up with this phenomena of teeth in an hour, teeth in a day.
Yeah. Is that what they're talking about when I see things like that?
Yes, that's commonly what you're talking about, is being able to, in some cases, actually take a patient's teeth out and put the implants in and put an immediate denture or tooth on the implant the same day. That is a tremendous service for patients who in the past had to wait 3, 4, 5, 6 months for the same thing to be achieved.
Is this what you're teaching other dentists?
This is a big part of what we're teaching other dentists today because, again, this is what the public is looking for. If you look at most universities in our country, they're all teaching minimally invasive surgical techniques. What they're trying to do is rehabilitate patients as quickly as possible and get them back to life. Get
so
them
less
back.
downtime when you say
Tremendous improvement in downtime and in discomfort. That's what.
It seems very painful, though, when I think of dental implants.
Well,
procedure.
Surprisingly, it's not. And the reason it's not, bone does not have a lot of nerves in it like skin does and other tissues. So we don't really have that amount of discomfort, and that's something
It's not something they complain about.
It's something they're nervous about.
Is that their number one fear?
It's one of their fears. And with modern techniques of sedation and local anesthetic, we can relax a patient. But what they're more worried about is when we start the procedure, are they going to feel something? And I tell patients, because I've been a periodontist a long time, that most of the time they're going to have less discomfort with doing a dental implant than they have with some of the other procedures I've done as a periodontist. And that's comforting to me as a surgeon to know that myself. But once a patient has gone through the experience and have realized that they didn't have that much discomfort and they're surprised how little medication they take, it reinforces that comfort level that we want to give them through the procedure.
You say the dental implant patient is probably the happiest group of patients in all dentistry.
Absolutely.
You believe that?
Yes, 100%.
Why?
Because they are so debilitated when they come in. Most patients' worst fear is they're going to break a front tooth and they're going to not be able to smile, or in some cases a patient who can't wear a denture now is worried about, can I ever be whole again? Can I ever chew the foods I want to chew again? Not have my dentures fall out when I'm in public or at a party. So when you give that patient back that confidence or tell them you're never going to be without a tooth, nobody's going to know, they just like wake up all of a sudden. And I've actually seen introverts go to extroverts.
They change, their personality changes.
Yes.
Just because of their teeth.
Yes, and there's just been recent studies in the Journal of the American Dental Association highlighting this phenomena, how the psychology of the smile and people's appearance, and there's two things that people look at, their teeth and their hair. Now that doesn't work for me.
All right.
It doesn't work, but for other people, their smile is a very important part of their personality, and when you restore their smile, you restore their personality.
Let's talk about the different categories of dental implant patients.
The categories range surprisingly pretty wide, from very young adults who are missing teeth as children and then now are adults and need their teeth replaced.
Okay.
And then there's the elderly patient who's been missing their teeth for a long period of time, been wearing dentures, doesn't know there's solutions out there. And then in the middle, we have people who have teeth or they're about ready to lose their teeth due to various dental problems. And then in some cases, unfortunately, we have people who are in accidents and injuries and they lose their teeth traumatically and they need to have dental implants.
Okay. Let's start with the single tooth. What does traditional dentistry offer and why a dental implant? What's the case for dental implant?
Well, my grandfather was a dentist, and in his era, he really only had a couple choices. He could make you something removable that came in and out, or he could prepare or cut down a tooth and then put a cap on top of the tooth or a bridge to span a space and replace the tooth. So for many years in dentistry, that was very traditional, very well accepted as part of the treatment.
And that's what still goes on today?
It still goes on today.
In what, 70% of the cases?
In a high majority of the cases. More
than that, probably? Nationwide?
I'd say 70 to 80% of dentists are still offering those services, and they're good services. I don't want to imply that they're not good services.
Just dental implants are a little better in your opinion?
Well, if you believe in doing minimally invasive and doing what's necessary, then I think dental implants are the option. Because when you do a traditional procedure to replace one tooth, you're going to have to do something maybe to a natural tooth that's perfectly healthy. And anytime...
You mean the surrounding teeth?
The surrounding teeth. The surrounding teeth, unfortunately, have to be altered or prepared, which means you have to cut down a perfectly good tooth to restore a natural tooth. Now, in some cases that's desirable because the tooth doesn't look good, so you make it better. But if you don't and you have natural teeth, then we can put an implant. It doesn't harm the natural teeth. An implant is very conservative because implants don't get tooth decay.
Is it like getting their tooth back? In a way?
It's exactly like getting her tooth back. What the implant really is an artificial tooth root made of titanium. And titanium doesn't get tooth decay.
Do they fall out?
No, actually dental implants are highly successful. My personal success rate over 25 years has been 98%.
Okay.
And that's supported by most of the literature that we read, is that you should have success rates above 95%. So for most patients, the implant itself is a lifetime replacement.
Any other misinformation out there about dental implants, or what are the frequently asked questions? I mean, patients go to you and they're considering dental implants. What do they want to know? And what are their fears, I guess?
Well, sometimes patients are told they're experimental. That's not true.
Is that right? Okay.
No, they've been approved by the Food and Drug Administration. They've had many studies done over many years with all types of replacements of implants that have shown very high success rates over a long period of time. Many times the patients are told they're expensive, and actually the studies show that when you compare it to conventional dentistry with the complications that can occur with conventional dentistry, an implant is actually cheaper over the lifetime of the patient for a replacement than a conventional dental procedure.
You also say that 4 or 6 implants could secure a denture. You don't have to do all or nothing.
That is another myth.
Which was my thought going into this.
Exactly, and that's a myth that a lot of patients and dentists have.
I mean, you count your teeth, it sounds very expensive.
Well, sure, if you had to put an implant in for every tooth, that would be expensive, but it's not necessary. And again, we have the ability, as you said, in some cases 4, 6 implants can replace an entire arch of teeth for a patient. So we can engineer it so that it's properly engineered for chewing, but not minimally engineered so that they have risk associated with their lifetime use of that appliance.
What about age? Anticipating this interview, my mother, she's 74 years old. She's been in dentures since early 30s. She says, Randy, I'm too old.
Your mother is my typical patient.
And she's a pretty healthy person.
Yes, and that's great.
At that age?
Absolutely. She is the person that and in my practice, I love to do implants with, because she's actually experienced dentures for long enough. She knows all the good and bad with them. But when you put the implants in and hook the dentures to it, now they're able to regain the confidence to chew food that they didn't have before, that they don't realize they've lost, and how they've modified their diet.
Is that right? Okay.
Modified their social structure. So when we do implants on that patient, they really have that transformation and their eyes light up, and they start telling their friends, it's really not necessary to suffer with dentures or even wear dentures.
People with dentures have friends that have dentures.
Absolutely.
And they tell all their friends.
Like begets like, and they talk about their stories with adhesives that they don't like, and when they had this little event with their denture and how funny it was when it happened. And many years ago, we didn't replace people's legs. We gave them crutches, and they walked on crutches. I look at it as a denture as a crutch.
But an older person, don't you have to take bone from their hip every time?
Very, very rarely.
Oh, really?
Very rarely, and this goes back to the CT technology we talked about early. We can actually know in a 3-dimensional picture how much bone that patient has before we do it. And we have these solutions now with doing conservative surgical techniques, minimizing the need for taking bone and rehabilitating the patient. So that's the beauty that the technology has brought today.
What's the upper end of age range for dental implant patients that you've seen?
I have actually done an implant on a 95-year-old patient.
But why would somebody 95 want to get a dental implant?
Well, actually, it's kind of a funny story. The oldest patient I've ever done is 95 years old, and she was in a nursing home with her husband, and her husband passed away prior to her, and he left his money to her, and she had always wanted dental implants her whole life. And when he passed away, she saw the opportunity, and she came into my practice, and she said to me the following statement: I want to die with the ability to eat food. I haven't done that for a number of years, and now by my husband passing, I have the ability to do that, and I have the resources to do it. So I want you to put some dental implants so that when I go, my teeth stay in my head when I die. And that was the story.
So what does she say? I mean, what do these patients say after, I guess, years of dentures?
They almost, to the person, say the following: if I'd have known it was going to be this easy and I was going to get this much out of it, I would have done it a long time ago. We're
going to take a quick break. We come back. I want you to take me through the process. Tell me the different options you have for denture wearers. You brought some photos, by the way, that are very, very dramatic, also very graphic. So we'll go through those right after this break. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you are thinking about dental implants, you got to see this next segment. We'll be right back.
This is really one of the most amazing things that's really happened to me, in the sense that it's not only physiological, but it's also psychological. you can't imagine the fact that not only can you eat, not only can you talk, you smile more. I find myself smiling all the time. Your whole attitude changes when you smile. And this, to me, is really kind of giving me back me. I used to smile all the time in the olden days, but now I'm back, and so I really enjoy that fact. How great I feel about it.
Before I had the treatment done, my teeth were loose. They were loose, and like they would come. The top ones were, some were lower and some were higher, so it looked silly. There were lots of gaps in my teeth. Since I've had the surgery, I feel like my mouth is healthier. I can eat apples, I can eat an ear of corn, and it's great. The people that work here at the office are just warm and friendly. I feel like they're part of my family. I mean, when I come in here, I'm welcomed and I feel very at home. I don't mind coming here to the office at all.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. It's all about dental implants today. With us we have Dr. Duello. Okay, dental implants. Let's go with the basics. You brought some models. What are we looking at here?
Well, I think we talked about this a little earlier, and this model emphasizes that very well. This is a person with a jawbone with teeth, and this is what
That's a lower jawbone.
That's a lower jawbone.
Okay.
And as dentists, we want you to keep your teeth, first of all. So this is our protection. But unfortunately, disease, accidents, periodontal disease, people lose the teeth, and sometimes people think, well, I'll just solve my dental problems by taking my teeth out, and that'll be the end of the story, and I'll wear a denture, I won't have to go to the dentist again, and they're off to the races. But the race, unfortunately, then is how fast are they going to lose their bone? And this sometimes is the end of the race. This is a patient who's lost a lot of bone, and sometimes...
So the absence of teeth, the bone goes away?
The bone goes away. In some people, slow.
Interesting.
Takes many years. Some people, unfortunately, it's a quick process, depending on other diseases and things. But this type of patient is now a dental cripple. They are not going to be able to have a denture under any circumstances made by any dentist that's going to fit, because there's nothing to fit it to. So this is not what we want to happen. This is not something I even want to show a patient.
Is it too late to get dental implants at that stage?
Surprisingly, we still can do dental implants on these patients, but we can't give them the options that we could have given them earlier, and I have a model that kind of actually shows you those two options. And for that type of patient, let's say the very severe patient, really sometimes the only option that we can give them is a denture that hooks on to the implants and is still removable. And for some people,
strong? I mean, they can chew with it?
It still works very well for them. And many times patients like that have been wearing a denture for years, so they're comfortable taking their denture in and out and cleaning it, and they still want that. So they want implants, but they still want to be able to take their denture out.
Snap in, snap out.
Snap in, snap out. So we have little snappers, little connectors that clip onto the implants and they take it out. This is called an overdenture.
Overdenture.
Overdenture. And it works well. It's been documented very well in the literature, and my patients who have had this do very well with it, and it's a long-term solution for them.
How many implants for something like that?
Anywhere from 2 maybe to 4, and in very severe cases 6, but 2 to 4 usually is the option for this type of prosthesis. However, in my opinion, this is not the best option. This is a good option.
So what's the best?
The best, and the one that patients want, is in a response to what the patients ask me. What can I get that's as close to teeth as possible? And I tell them the best option is to have the implants fixed to the denture. They will not be able to remove it. They will not, unless your dentist has the instruments to take it out. So it acts like teeth, it feels like teeth, it chews like teeth, and it stays in the mouth. So you don't have to worry necessarily.
How many implants for that?
In some cases 4.
Isn't that right? 4 and you could have a fixed.
Right, 4 up to 10.
You said something interesting to me on the phone, that you said if there was a try-in period, that means the denture wearers had a try-in period for dental implants. They could never go back. You believe that?
Absolutely. Would never go back. I've never had a patient say, take these out, I don't like them.
I mean, it's that much of a difference, I guess.
Yes.
They forget what it was like to chew again? I mean, is chewing the biggest thing? Is it more self-esteem?
I've seen all. I've seen chewing, self-esteem, people who are in the media industries who now can speak because that's what they do for a living. In some patients, a patient was having her daughter get married and she wanted beautiful teeth for her daughter's wedding, and she didn't like her old teeth. They were loose, they didn't look good, and she says, I'm happy as a clam now. And I know she went to the wedding with a lot of confidence. She was beaming.
How do they look though? I mean, can you make them look real in the front?
Well, the fun part about doing dental implants at this level is I tell patients you get to design your third smile.
Right.
Because the first two sets of teeth, genetics, hereditary, that's how you got those teeth. But this set, we can actually characterize to match your face, to match your complexion, to give you a vision of something maybe you had for your teeth, but you never got because hereditary and your parents didn't give you.
All right.
So the third set of teeth is your design with the dentist. And that's why a team approach, working with your dentist and working with us as surgeons and doing photography and things and imaging that we can do today, is a great way to help people get the smile they want. Randy, I think sometimes a picture is worth 1,000 words. And I brought a few pictures to really show a dramatic case. Many are not as dramatic as this, but this is a dramatic case where a patient really had a turnaround in their life by doing dental implants. Okay. And this is the patient.
Wow.
And I know people look at that and they say, wow. And
that's a mess.
Yeah. And as a dentist, we're concerned by a patient.
Is
like
that rare? That must be very rare.
It's unusual. It's unusual, and we as dentists don't want to see a patient suffer like this. We're quite concerned for this patient's well-being to make sure that we get them away from this situation as quickly as possible so they don't have severe pain and are debilitated. So fortunately, this patient wasn't having a lot of pain, but he had a lot of issues with his smile and he just didn't feel comfortable. He had 2 elderly parents he took care of, and he was a very nice gentleman, a very quiet gentleman, reserved gentleman. But he came to us asking for help, and fortunately today with dental implants, we are in a perfect position to help this gentleman. So we obviously can't save his teeth, and we had to remove his teeth, but with technology today, we were able to take his teeth out and at the same time replace them with dental implants. So he went from this to something like this, which is rather dramatic.
Wow, it's very clean, very nice.
It's very clean. He can function, he can chew foods, but that's not the gift that this gave him back.
What is it?
The real gift, in my opinion, that this patient got was he got his smile back. Because we know that patients like this actually lose their smile and their muscles lose their ability to smile. So when we were able to treat this patient, and at the end, this is what you saw as far as his teeth, but what I saw was this patient's life come back. And the
huge difference.
And the beauty of a smile in a face and the warmth of a smile. And that was the reward that I got as a dentist, not doing the surgery and the technology, but having a person become comfortable with themselves again. Randy, what I really want to show you is a side-by-side picture, because this is where it really tells the story. This is a picture of this patient when I asked him to smile. And he had a lot of difficulty in doing it. It wasn't about his teeth. He physically couldn't smile. And when we gave him back his teeth with the dental implants,
he looks like a different guy. He looks much younger.
He looks younger. He's more confident. He smiles. It almost brought a tear to my staff's face when we saw these pictures, to see this literal transformation of a human being by doing a procedure for him that we feel sometimes is routine, but for our patients change their lives.
So does it all start with options? They have to know their options?
Yes, and they have options. They have good options, they have...
So they go in, find out, get evaluated?
Yes, yes, that's the key, is starting with a thorough diagnosis, and we have everything in our office available, the latest technology, and most importantly, it's not necessarily the technology, it's the time. People want us to spend time with them.
Do you meet with every patient?
We meet with every patient. The first visit usually is a minimum of an hour with myself and our staff to obtain the information. Then what we do is we actually consult with their dentist privately, and then we have them come back for the treatment consultation or review of findings. And at that visit, we present to them what has caused the problem, what is the prognosis, and what are their treatment options. And many times we present a good option, a better option, and the best option.
We are out of time, but another thing I learned from talking to you on the phone prior to this interview, that not all dentists nationwide are doing this the same way. So what should somebody look for in a dentist that's going to be doing dental implants?
Well, I think the thing you need to do is you need to do your homework, and you need to ask the appropriate questions as a patient.
And what are those?
How long have you been doing this? How successful are you? Do you have options available for patients, or do you only do it one way? Have you had experience with other implants? Have you taught dental implants? Is this the majority of your practice, or is it a little part of your practice? Are you a specialist or a general dentist? Not that general dentists can't do it, but a lot of them don't do it as much as we do it, and so we feel comfortable with that.
I asked you, you travel like 2, 3, 4 times a month on a plane to talk about dental implants.
Yes.
It's that important to you, this cause?
It's not that dental implants are important to me, it's important what they do for our patients.
Okay.
And in the history of dentistry, dentists have never had the ability today to help people in the manner that we can help them with dental implants. That's my passion.
It's good.
That's the benefit that we have for our patients, as opposed to my grandfather, who was limited by the technology available when he was a dentist. But today, the technology is here. And my passion is to share that with my patients, to share that with my professionals, friends, and colleagues throughout the world. And I think dentistry as a profession has elevated itself because of dental implants.
All right, I want to thank you for coming to the show. Very good, very good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to watch this again online or point a friend in the direction of this interview, you could visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.